Teachers are expected to report back to school tomorrow to prepare for the eventual reopening of schools in October. But are schools really well prepared? Well, the Kenya Medical Association is urging extreme caution before children can report to school, further urging the government to justify the reopening with an epidemiological pattern and to clearly state the measures put in place to deal with a possible second wave of infection after the reopening. Well, tonight, Dorcas Wangira examines the lessons Kenya can learn from countries where children have already gone back to school.
Ahead of the reopening of schools, there's so much work to do. Some schools have put in measures to provide a safe space for learners, adjusting their timetables to ensure phased learning, changing seating arrangements so that the learners can sit at least 1.5 meters apart, anticipating new furniture from the government's 1.9 billion shillings desk project. The president is expected to give direction on when schools will reopen, priority to be given to candidates according to proposals presented last week. The Teachers Service Commission has asked teachers to report to their respective schools ahead of the president's announcement. But the glaring truth is that not all of Kenya's schools are able to meet the health and safety protocols for basic education institutions for close to 9 million school-going children. What plans are there to provide pediatric masks and hand sanitizers? Will all teachers and non-teaching staff be tested before reporting to school? What happens if a student or school staff is infected with COVID-19? The Kenya Medical Association wants the government to justify the reopening of schools with evidence from a reliable epidemiological pattern.
Our children are the future for this country and they need to be protected. And we should not use them as guinea pigs by opening schools so fast without adequate data to support that. There are more than 1,500 medical doctors who are willing and ready to be deployed to all our facilities as we prepare to open our schools.
Globally, the reopening of schools is still a contentious issue. What lessons can Kenya learn from the rest of the world? The new school year began in Tunisia Tuesday, 15 September, with precautionary measures. More than 2 million students returned to schools in the country after 6 months of closure. In Pakistan, thousands of schools and colleges reopened. The country's education minister earlier had announced that the reopening of 300,000 schools, colleges and universities would be in phases to avoid another wave of the virus. After a 6-month shutdown, the longest in Europe, Italy finally reopened most of its schools on September 14th. There are no hugs, no kisses, no walking hand in hand in corridors. Instead, the temperature checks are at the entrance, there are single desks, hand sanitizers and protective masks were waiting for children. Many of the new 2.4 million single desks needed to guarantee social distancing had failed to arrive in time. The United States of America still does not have a national policy on reopening. Different states and different counties have opened schools based on separate guidelines and advisories. Botswana had reopened schools on May 21st. However, in subsequent months, the country recorded a spike of COVID-19 cases from schools. South Africa had to close its schools twice when coronavirus cases exceeded 40,000. In late July, 98 students tested positive for COVID-19 in one school after what authorities said was a failure to practice social distancing and the wearing of masks.
We should open schools, but should open in a phased manner. And we should have isolated facilities in case our children are affected. And also we should have proper PPEs.
According to a research by WHO and UNICEF, only a quarter of schools in sub-Saharan Africa have basic hygiene services. Just 44% have safe drinking water and only 47% have basic sanitation services. Dorcas Wangira, Citizen TV, Nairobi.